My name, by the way, is Dr. Yearsley, and I'm a behavioral health doctor as well as a licensed clinician. I'm a licensed social worker and a licensed addiction counselor. So I look at things with a particular lens. And over the last few weeks, I've had some people ask me about, drum roll, trauma. Okay, so trauma is something that is going to show up with, right now the statistic is 90% of US Americans have experienced some sort of trauma. 90%. That was not a flub up with the camera. That is the truth. And I think that with this type of statistic, especially coming out of the pandemic, that it is worth my time to do a series of videos on trauma. So for the rest of June, I'm going to talk about trauma, and I'm going to try to take all of these topics that are related to trauma because it is a huge subject that you can't talk about in an 11 to 15 minute video. Just not going to happen. Even if I wanted to, even if I could talk that fast like some really awesome TikTokers, it's just not going to happen because I don't think that fast. So what I've done is I've broken it down. I have all these papers all over my desk. I've broken it down into pieces of trauma that I hope will be easier for everybody to understand. So I teach at the collegiate level as well as have a private practice. And I teach at two different universities. And at one of those universities, I was asked to teach a trauma class. And so this is something that's near and dear to my heart in terms of staying close to the research and how we view trauma as it shows up in mental health, because it always does. Okay, it always does. Whether the patient is aware of it or not, trauma is lurking somewhere in the distance, okay? Hopefully throughout this trauma series, you'll be better educated about what trauma is, what part of the brain it affects, how it shows up, what are some of the symptoms, what are some of the treatments, and what you can do about it. Because when we're struggling with side effects, so to speak, or symptoms related to a traumatic event, it can be all-encompassing, meaning it can just tap into every single part of our life, whether you are realizing it or not. Okay, so let me give you another statistic. Trauma is a risk factor in nearly all behavioral health and substance use disorders. Nearly all. Trauma is a risk factor in nearly every behavioral health and substance abuse case that I work on. Yeah, that's also not something wrong with the camera there. It's the truth. So when I am looking, assessing, talking to patients about their history, we are definitely going to talk about trauma. So what is trauma? Okay, this is video number 1, part 1 of trauma. But what is trauma? Trauma can happen to anyone at any age. Okay, any age. Even infants can experience trauma. And it affects everyone differently. There isn't a standard list of symptoms in how it shows up in every person every single time, no matter what the age, no matter what the experience. That's not how trauma works in the body and in the brain. Did you know that trauma, its memories and its associated impacts happen to different parts of your brain? That's right. Trauma memories are stored in different parts of your brain. And we can associate traumatic memories and experiences within our 5 senses. That's right. I'm going to talk a little bit more about that later. Let's say that a family of 5 experienced a horrible, tragic event of losing their home. All 5 of those people might come into therapy, and every single one of those family members most likely is going to share a very different experience about their home burning down, meaning how they understand it, what happened the night that it happened, in terms of what they remember, what they saw, what they felt, what they heard. All of those experiences can be different. How it shows up in their physical symptoms now, meaning what are they experiencing now that the fire is over and the tragedy has happened? You know, how's that showing up in their body and with their mental health? All of these things are different based on the person. And by the way, that's completely normal. So you can have a large group of people that have experienced a huge tragedy like 9/11 or the COVID pandemic. And if you go and you speak with these individuals, they're all going to have a very unique and valid experience related to the trauma that they endured. What I'm here to say about trauma is this is not a place or a time where we can put on judgment glasses and say, well, that didn't happen that way. Or, I really think you're overreacting. Or, you are the only person that sees it that way. Or, I think that you're blowing this out of proportion. Any of those comments to someone who has experienced a traumatic event is inappropriate. And frankly, it's minimizing, it's belittling, and those kinds of comments make the trauma worse. Trauma has a way of showing up with our mind and our body that can vary over time. It kind of looks like this, right? It can come in and it can come out in terms of how we're coping with it, how we're grieving through it, or how we're not. So, just being open and being supportive to whatever the person needs at the time is going to help them move through and hopefully work through that traumatic event. Okay, so let me give you a really simple definition of trauma, because you may be thinking, what does trauma include? Right? Like, what qualifies as a traumatic event? All right, here it comes. It is any event that put you or someone close to you at risk of serious harm or death. Okay, so that is the definition. And our usual ways of coping get overwhelmed, and so it leaves us feeling frightened, exposed, and unsafe. So we can be traumatized through a lot of different lenses, okay? A lot of different experiences here. And this is true for children as well as adults. And so it's really important that we are being accepting and affirming of people who have experienced something traumatic, because they can be re-traumatized just from us acting like it never happened. Let me give you some ideas on how trauma can happen. Now, this is not an exhaustive list, but these are some of the most common instances that I see come through with my patients and students. All right, here we go. One-off events such as an accident, a violent attack, a natural disaster, COVID pandemic. Yes, ma'am, that is a traumatic event for a lot of people. So one-off event, meaning it happened one time, it shakes up your world, and then you're having to deal with it on the back end. And this doesn't necessarily mean that it was experienced by anyone else but you, okay? It can be collective, meaning it's happened with a group, or it can be a one-off experience. Okay, ongoing stress such as childhood or intimate partner abuse. So any kind of abuse that happens within a family relationship or that happens as a child. And I'm going to talk a little bit about ACEs, adverse childhood experiences. Now, look that one up, okay? I'm going to put it down right here so you can see it. But I'm going to talk about that later. So bullying, long-term illnesses, or even, like I just said, the COVID-19 pandemic for children can be particularly traumatic. Living in an unstable or unsafe environment. So the key word here is unstable, meaning chaotic. It's not part of the norm, okay? That's trauma. And also unsafe. So when a traumatic event happens, we feel threatened. Our safety, our life feels threatened. We feel that danger, and our body senses that danger immediately. And sometimes it's even before we even realize and have processed what's going on. Our bodies and our brain is very, very smart that way. So if you are sensing or living within an unstable or unsafe environment, that can get to be really traumatic for a person. Also, seeing someone else get hurt. So witnessing violence or witnessing a tragedy or witnessing someone's tragedy, that can be very traumatizing for somebody. So let me just say a word here. How you are affected by trauma is absolutely in no way related to how strong you are as a person. What a load of poppycock, folks. This is just not even true. Look, if you're experiencing a traumatic event, all of us are going to be impacted by that on some level, in some way. It is not a trauma meter of how strong you are versus how weak you are. Okay? We don't have control. We really don't. We don't have control about how our brain and our body is going to respond when the event happens or post-event. Keep that in mind. So let's be careful about how we're judging other people's reactions about traumatic events. Now, our reaction to trauma can depend on a few different things. Number one, I would say a sense of safety. If you have, at the current moment, before the tragic event happens, a sense of safety in your life and you already have some coping skills, this may impact how trauma hits you, how it impacts you, what happens next, okay? Also, if you have experienced other traumatic events in your life, that could definitely impact the way that you respond. In addition to the fact that if you've got other stressors in your life that are causing compounded stress that make this traumatic event even more intense, that's a factor, as well as how much support do you have post the traumatic event? Is this something that you're going to be circled around by loved ones, friends, family, significant others, or is it going to be an experience where the traumatic event happens and you're alone? So all of these things can impact the way we process through trauma or the way that we don't. And so the reason for me talking about this is trauma is something that happens to nearly everyone. And so why aren't we doing more to be compassionate about what's going on with our fellow man? So I've shared a little bit about what trauma is in a very simple explanation. But what I'd like to do is share some ways that trauma can show up. Child abuse or neglect definitely can cause ongoing trauma. War and other forms of violence, physical, emotional, or sexual abuse of any kind, it doesn't matter what age you are, accidents and natural disasters, grief and loss of any kind, medical interventions, chronic illnesses, witnessing acts of violence. So this could be, seeing or witnessing or hearing acts of violence or traumatic, tragic events that have happened to other people, as well as cultural, intergenerational, and historical trauma. I think this one is really important because until probably the last few years, I don't feel like we've done a good enough job validating and honoring that this can actually be traumatic for some people. So I'm glad that this one is now being talked about, and I would encourage you to look into these factors if you're trying to figure out why you're responding the way that you are. So why is my body and my brain reacting the way that it is to a traumatic event? All right, so our bodies and our brains are hardwired in the limbic system to survive. We have a built-in survival mechanism in our brain that allows us to cope and act in the moment to preserve our survival. Now, we don't have control over what happens in that survival moment. It's almost like our brain takes over. It's hardwired, okay? Think of it that way. And what is happening is we have a fight, flight, or freeze response to stress, to feeling danger. Now, in addition to fight, flight, or freeze, there are some additional reactions that I'm going to teach you about because I think that it is more than just those three. I've seen traumatic reactions happen in some additional ways that I think are important for you to understand. So here we go. So number one is a fight response. When you are faced with danger, you're going to fight that response. And it could mean being defensive, protesting, arguing back. Any of those things can be perceived as your fight against what you perceive to be dangerous. Two is flight. So what does that mean? It means you're going to get the heck out of there. That's what it means. You're going to run away. You're going to escape. You're going to remove yourself from that traumatic event. That's number two. Number three is freeze. Now, we've all heard of people who, when something traumatic happens, we freeze. We are not able to move at all. That is the body's response to a dangerous stressor and stimulus. And it is not something that the person can control. They freeze because of that fear, and they are unable to move or even make decisions at that point. This is a real thing, folks. It's called freeze. So number 4 is really important if we're talking about feeling unsafe with other people. So intimate partner violence, bullying, all of these situations have a unique survival mechanism system within the limbic system of our brain. Okay? So what is fawning? It is trying to please or win over someone that is hurting you. Okay? So we fawn to that stress response. We are just trying to calm it down, to de-escalate it so that we are not hurt. The last one is flop. And I think this one is worth mentioning because we are hearing and seeing a lot more of tragedy and traumatic experiences surrounding positions of power. So if this is an intimate partner violence, some sort of sexual assault, this definitely shows up when we're talking about mental health treatment. And here's how it may sound. Really, the patient becomes overwhelmed and unresponsive. So they're going to do what they have to do to get through that dangerous event. And one of those ways that they do that is by dissociating. What that means is you are disconnecting from the experience. Sometimes they don't remember it at all. Sometimes they do remember it, but they are trying to focus, and their brain and their body thinks about another event during that period of time, during that tragedy. And this feeling disconnected from your body or dissociating can also include fainting or blacking out. Now, I've heard of all of these things in reference to traumatic events, so I think it's worth talking about. So as a recap, because there's going to be part 2 to this video, today I've talked about what trauma is, different areas that trauma can show up, or how people can experience tragic events. Not an exhaustive list, but these are the main things that I'm seeing in therapy. And number 3, how our body and our brain respond. So basically, I've talked about the limbic or the amygdala center of our brain being the survival mechanism of our brain, and it actually is hardwired to protect us from danger. Now, in my next video, I'm going to talk a little bit more about the physical side of what we can experience in trauma and some ideas about what you can do about it in terms of treatment. Don't forget to subscribe to my channel so you know when these new videos are coming out. And thank you so much for watching.